Welcome everyone to this webinar organized by Altrui and Apricity in collaboration with Becky from Defining Mom and Paths to Parent Hub. My name is Lucia and I'm part of the Apricity and Altrui team. For those who don't know, Apricity and Altrui are sister companies. We work together to offer a full suite of fertility services, from fertility diagnostics to egg donation. And Altrui brings their tremendous experience and knowledge of egg donation to Apricity, and that's why we're here today to share some of that knowledge. I'm joined by Jane Holman, the Altrui lead. Hi, Jane.
Yeah, hi, lovely to be here.
I'm also joined by Lisa Stradiotto, one of the doctors at Apricity. Hi, Lisa.
Hello, hi everyone.
And I'm joined by Becky Kearns from Defining Mom and Paths to Parent Hub, who, as you all probably know, she's a fertility blogger, a speaker and campaigner who we love working with.
Hi, everybody.
And we also have with us two very special guests, Jocelyn, who welcomed her son last year after using Altrui and Apricity for egg donation and fertility treatment. Hi, Jocelyn. And Sally, who donated her eggs with Altrui not only once, but twice.
Hi.
I'll just start by doing a quick recap of the agenda for today. We're going to start with Jane, who's going to tell us more about Altrui, how we work, and how we have been working during these unprecedented times. Then we're going to move on to Dr. Lisa, who's going to answer some of the most frequently asked questions about fertility treatment, pregnancy, and COVID. Following Lisa, Becky is going to interview Jocelyn and Sally, who are going to tell us more about their journeys. And finally, we'll save the last 10 to 15 minutes to answer questions that we have been receiving in the past few days. So without further ado, let's get started with Jane.
Lovely, thank you very much, thank you. And it's lovely to be part of this really, and just to share a little bit more information about Altrui and our services and how we work. Altrui have been established for a number of years, about 10 years now, and we pride ourselves in working very closely with our clients, our recipient couples, and also our donors as well. So for us, it's really important to establish that connection on both sides, but also look at trying to provide a sort of real bespoke, personalised service for our patients on that fertility journey. We fully appreciate, you know, moving to donor eggs is very different to having IVF treatment. And for some couples that come to us, obviously they haven't even had fertility treatment at that point, but they're just exploring their options to look at trying to create a family. So for us, it's really, yeah, we welcome being part of that journey. We have obviously, I suppose we need to take into consideration the needs of the donor. We need to take into consideration the needs of the recipient couple during that process. And that means that we work very closely on both sides. So we look at the patient journey. We look at where patients have been for treatment so far, and we also look at how we can best support them moving forward. So we want to explore all possible options, but we also need to take into consideration, I suppose, what the donor needs as well, because we need to offer flexibility there and ensure that we can engage with the donor going through this process. So it's important to us to really look at how we can do that. And we've obviously had to make some changes in the last year to account for the pandemic, which I think is a real key focus of tonight's session. So we have introduced some virtual pathways with some of the clinics that we work with, mostly with Apricity as well. And for us, that really opens up a number of opportunities to make the process a lot smoother, a lot quicker and a lot easier for a lot of our patients. And what that involves is looking at trying to make the donor's journey a lot easier by offering local scans, offering blood tests that can be arranged closer to home, or even by a phlebotomist going into the patient's home as well to try and make it a bit more patient friendly. And that means that we can really reduce the number of appointments that the donor needs to attend for at the licensed treatment centre. So the way we work with Apricity, our sister clinic, is that referrals are sent in through the Apricity pathway. It means that we can support the donor and the recipient by remote appointments, so things like Skype and Zoom consultations, making it a little bit easier on both sides and really sort of supporting them through that journey. And I think we've been able to open up, I think, that geographical pool to donors that live a significant distance away from the licensed treatment centres as well. So for us, it's being able to open up that scope, have more donors available, and be able to support them through that process and through that journey. I think on average, we try to get cycles through the Apricity pathway to egg collection within about 3 to 4 months. That's what we aim for. Obviously, recently we've had to allow that to be a little bit longer because the processing time sometimes take a little bit longer. But I think that the good thing is that we can offer that flexibility, which has really opened up that scope for us in supporting patients through this pathway. So yeah, I think it's significantly made some changes really for us. I think certainly from a donor's perspective, I think Sally, you probably can also comment here because you've experienced the Apricity pathway as well, and I think it really has made some changes. And I don't know whether you want to sort of elaborate on what your experience was as well.
Yeah, definitely. The main thing for me has been the remote access of it. So being able to talk to someone at the end of an app has been really helpful, that are available kind of a lot of the time, and being able to have remote blood tests either from a home or very close. That's been a really helpful time within the last year of COVID as well.
Yeah, absolutely. And I think that's the thing, isn't it? It's about trying to work together. We still obviously work very closely with the donors and with the recipients as they go through this process and this journey. And that smooth transition that we like to be able to offer as they pass into the Apricity pathway when it becomes more clinical. You know, it's about trying to work together and support patients. And I think that we've successfully achieved, and I'm very proud to say that we have. So we have put a number of cycles through that pathway, and I think certainly from a donor's perspective it's been very favourable because it does allow us to be able to work with donors that are located anywhere within the country, whereas before we had to consider donors attending clinics for a number of appointments. So that potentially could limit the number of donors that we had available to us, and therefore to support our recipients as well coming through this journey. I think on the recipient side, just really I'd like to elaborate there because I think, and Jocelyn, you may want to sort of intervene here, but you know, certainly for us, having the opportunity to have more donors available, to look at the recipient's requirements, not only in the physical match with the donor, but in other ways as well. I think having more donors available will certainly give us more options to be able to take patients through these pathways, and support patients a little bit more. Definitely.
Great, thanks, Jane. Many people might be wondering about the process and what happens when they decide to contact Altrui. Could you please explain a little bit how the process with Altrui works?
Yeah, sorry, yeah. I mean, Altrui, when we get, when a client inquires with Altrui, we will obviously look at what treatment they've had so far. We will look at what treatment they require and how quickly they need to be able to proceed. And we want to aim to support them going through this journey. So for us, it's about working closely with them, the registration of that patient if they decide that they want to work with Altrui, you know, making sure that they're aware of how we work differently to potentially some other agencies or some other clinics that provide egg donors. You know, for us, it's about looking at the bespoke journey. It's looking at the one-to-one donation. The donors that come through this journey are really looking at trying to support recipients, trying to sort of help them in any possible way that they can. All of the eggs that are collected within a donation cycle will exclusively go to one recipient couple. And I think we're quite unique in the way we work, in what we deliver with that. So on average, we try to aim to get between about 14 to 15 eggs per treatment cycle. That therefore will potentially give an increased number of potentially embryos that can be achieved from that, and I suppose therefore a statistical increase in the number of embryos that potentially can be stored as well. So I think all of that gives that better chance for the recipient couple. The statistics are greater, but I think it also gives that potential for the creation of a family. So if you wanted to come back and think about maybe more than one child, you know, hopefully if treatment was successful, then you have a better chance of achieving that with a sibling that is genetically related and not having to go through the whole egg donation process again. So I think that's what's quite unique about Altrui as well, and we really pride ourselves in delivery of that service and sustaining the high success rates which we have maintained for a number of years, which we're very proud of. Yeah, definitely.
Thank you so much for all of this information, Jane. We'll speak to you again shortly during the Q&A, but now we're going to discuss the impact of COVID and the vaccine on fertility, fertility treatment and pregnancy with Dr. Lisa. So Lisa, could you start by telling us a little bit about yourself?
All right, I as many of you may work out, I'm from South Africa originally, and I did the first part of my training in obstetrics and gynecology there, and then I came over to the UK over 12 years ago and continued my training here, and I've worked doing general obstetrics and gynecology. I've also worked at King's. They have a big fetal medicine unit, and I did a fellowship with Professor Kypros Nicolaides. And then I got into fertility. But there's a close association between fetal medicine scanning and gynecology scanning for fertility. Yes, so, and that was over 7 years ago. So I think it's a wonderful, I'm really honored to be part of the profession and the field, because and generally obstetricians and gynecologists say this, we're not looking after sick people, you know, and even more so we're helping to create families. So yes, I'm very proud of the discipline. And certainly working with Altrui and Apricity, really I've got such wonderful colleagues, and it's such a little bit of a family company. Not that we're related, but one feels like one's a member of a little community and a family, which is really lovely. And we try to you know, pass that on to our patients in the way we treat them. We're very happy, all of us, the nurses, doctors, advisors, Jane, to be contacted for queries and if patients are concerned about things. So yeah.
Lisa, in the past year, there has been a lot of confusing information circulating on the media and on the internet and social media about the impact of COVID and the vaccine on fertility and pregnancy. So we would like to provide some clarity and answers to the most frequently asked questions about this. So the first question is, for someone trying to conceive, should they get the vaccine or should they delay pregnancy?
So the UK bodies and the latest advice from the Joint Committee on Vaccination and Immunization and the Royal College of Obstetricians and Gynecologists, which is a UK body, and the British Fertility Society, have recently released a statement saying that there's no evidence and no theoretical reason that any of the vaccines can affect the fertility of men or women. And that it's safe for people of reproductive age to have the COVID vaccine, and they should do so when they receive their invitation according to their risk profile. So this includes those people who are trying to have a baby or who are thinking about having a baby in the future. It also includes people undergoing fertility treatment, so IVF, frozen embryo transfer, egg freezing, and also those people who are donating their eggs or sperm for the use of others. And the recommendation is that it's safe to have the vaccine. Furthermore, women who have had recurrent miscarriages and are now trying to get pregnant, the statement from this group is that they don't need to postpone having the COVID vaccine, as it will not affect the risk of having a miscarriage. So there's no need to delay treatment after having the vaccine, unless you wanted to wait until you have your second dose, which of course confers additional protection. However, for women in treatment, i.e. in the middle of their IVF or egg stimulation cycle, it would be sensible to separate the date of the vaccination by a few days from the actual treatment procedures. So for example, when in IVF, when one has an egg collection, so that any symptoms from the vaccine, such as fever or muscle pains, might not be incorrectly attributed to the procedure. And also cause additional discomfort, because many people have, a sore arm or feel quite rubbish after the vaccine. And then if you then have to go through an egg collection, that's more traumatic. And indeed, vaccination pre-pregnancy should be encouraged, as it's the best way of reducing one's risk of catching COVID-19 in pregnancy, or if you do get it, you're more likely to get a milder illness. But this is, as I've said, it's very difficult to make kind of blanket policies. And for women who plan to conceive but are not yet pregnant, really they have two options. The one is to defer pregnancy until steps to effectively mitigate the risk of the pandemic have been undertaken. And these risks would be substantially reduced virus transmission or availability of vaccines and access to prenatal care. And in areas with ineffective control of the pandemic and limited resources for vaccination, this may be a preferable option. So perhaps this option applies less to the UK. And then the second option is to proceed with efforts at conception, continue with mitigation measures, and get a COVID vaccine as soon as possible. Each choice, of course, offers potential benefits and risks. The first option, i.e. deferring pregnancy, would of course pose the least risky one, but this may not be the best option for women with a shorter reproductive horizon. And, many women have been, not through any choice of their own, pregnancy is delayed. And so for these women to offer this as an option is not necessarily the best thing. So I think the second option, to be vaccinated, ideally prior to conception, is preferable. And it's important to remember that one doesn't need, after having your first or your second dose of the vaccine, you don't need to delay pregnancy after that point. Because the real risk comes when pregnant women contract the coronavirus. Some women are very lucky and they get a mild disease, but others aren't. But that's going into a different topic.
Yeah, no, actually, it was the next question: if pregnant women are more likely to be impacted by COVID.
Okay. So again, none of the questions you're asking are really easy, Lucia. So because so whilst so if you're pregnant, your chance of getting COVID-19 is not necessarily higher than anyone else. It's not like malaria, where pregnant women are more susceptible to getting malaria. However, studies have shown that if you're pregnant and you do get COVID, severe illness requiring hospital admission is probably more common in pregnant women than in women who are not pregnant. And this is particularly so for the third trimester. And we've seen in the third trimester the risk of preterm birth and of problems in the mother, respiratory problems, and even really adverse outcomes is more likely compared to other pregnant women who don't have COVID-19. So really the take-home message is that one wants to avoid getting COVID if you're pregnant, which is why even women who have been vaccinated must still take measures to reduce their risk. So, and the Royal College advises shielding after 28 weeks. So if you can work from home, you know, don't try not to socialize in big groups, or the mitigation risks if one is pregnant.
And when pregnant, is there a risk of transmission to the fetus, and what would be the impact if it does get transmitted?
So yes, there is a risk of transmission to the fetus. However, all the evidence that we have has shown that the baby is usually fine. It seems that the mother's at great risk. Also, women who the most overwhelming evidence that we've got is that babies are born early, so preterm birth, and that brings with it a whole lot of new sequelae. So of babies needing neonatal support and all these problems associated with preterm birth. There have also been instances where women have contracted COVID around the time of birth, so just before the baby's born. And again, when COVID has been passed on to the babies, they're usually fine. And even in women who are breastfeeding, who've had who've passed on COVID, these babies have also been fine.
Okay, so that's reassuring.
Yeah.
Thank you so much, Lisa. We'll speak to you again shortly during the Q&A. But now I'm going to give the floor to Becky, who's going to introduce herself for those who don't know her, and interview Jocelyn and Sally. So Becky, the floor is yours.
Thank you so much, and hello everyone. For those of you who don't know me, my name is Becky Kearns. I'm a mom to 3 girls through egg donation, and I also am known as Defining Mom on Instagram and through my blog. So about 2.5 years ago now, I started sharing my story in the hope that I could offer others hope at the other side of having to use an egg donor to build my family, and also to offer support as well. I remember back when I was going through my journey, I was diagnosed with early menopause at the age of 27 and didn't really know anything about egg donation or anyone that had been through it, and it felt like a really, really lonely journey. And it's only now on the other side that I've really realised how significant it was, and the impact it had on my mental health, and the number of different things I had to navigate at the time, and how there needs to be better emotional support out there for people who are going through this process. And this is what I talk about a lot. And last year I launched a platform called Paths to Parent Hub, which is designed to offer information, support and connection as well to people on this journey. So I look at all of the emotional factors that are involved. So Altrui and Apricity do a great job with the practical side of the process, and are really, really supportive of offering this as an addition for recipients throughout 2021. But what I want to provide is information around those common fears that we have. So things such as, will I bond with my baby? I'm worried about how my child might feel, or how do I talk to them about how they were conceived? And so we cover lots of different topics through lots of different webinars with lots of experts and parents who have been through it and are kind of now parenting later on in life. I talk to people who are donor conceived themselves. So it's just to explore all of the other aspects and all of those other questions that you might be thinking about as part of this process. But I'm not really here tonight to talk about myself. Always happy to answer questions if anyone does want to connect with me on Instagram, but I'm here to have a chat with so Jocelyn as a recipient who had her little boy last year, and then also to Sally, who has donated her eggs as well. So I'm going to start with you, Jocelyn. Can you just tell us a little bit about your story and your journey to where you are today?
Yep. Hi Becky. Yeah, of course. So I am a solo mum by choice to my little boy who was born last summer. He was born via sperm donation and egg donation. He's a double donor baby. And as mentioned at the beginning, I was a patient, a client of Altrui and Apricity through that experience as well. I guess my fertility experience started about 6 years ago when I was actually embarking on the process of egg freezing and found that I had a very low ovarian reserve. So I did do a couple of cycles of egg freezing, which weren't very successful. I then made the decision to try for a baby and had a couple of cycles of IVF using my own eggs, which weren't successful. And then, yeah, came to the decision of trying with donor eggs as well.
Yeah. So how did you go about choosing your clinic, and because there are so many different options and things to think about? How did you go through that process?
I mean, very early on when I was looking at egg freezing, it was Google and the HFEA website. And then I actually switched clinics and had my IVF using my own eggs with a clinic that was recommended to me through a friend and colleague of mine. So it was a very sort of strong personal recommendation who had built their family through this clinic. So that was sort of what made the decision for me initially. And then ultimately the clinic that I was treated at and that my donor was treated at was kind of, the decision was made for me, because the process that I went through with Altrui and Apricity is obviously very mindful of what the donor requires, and so the clinic was chosen based primarily on what was convenient and appropriate for the donor, and also for me as well. So there were lots of factors. I ended up having some treatment at the clinic where the donor was treated, and then I also opted to pick up some of my post-transfer care with the clinic that had treated me previously for my IVF cycles, and that was just a personal preference. They had all of my history and my background, and they offered particular treatments that this other clinic didn't. So yeah, I ended up kind of mixing and matching clinics. And yeah, exactly. But it can be really difficult to pick and to compare as well. I think comparing the clinic information can be really challenging.
Absolutely, yeah. And how did you find the donor matching process? So in terms of, I mean, I remember I was matched by my particular clinic. I went to the Czech Republic, and it was very, very limited in terms of the amount of information I had, and it was sort of out of my hands in a way. But kind of, can you just talk a little bit about the process you went through there?
Yeah, I mean, I guess I had a particular experience because I went through the selection process for donor sperm and the selection process for donor eggs, and so I could see actually how different they were, particularly if you were choosing donor sperm from other countries. And my first sperm donor that I tried with, I had reams of information. They were from an American clinic, and I was looking at adult photos and family history and all sorts, and that was actually quite even when I came to choose a UK sperm donor, it's a bit more like looking at dating profiles. You're kind of comparing, and you get a short list, and I had a spreadsheet, and I could narrow it all down and kind of compare to make the decision. But going through the process of selecting an egg donor, it's very different, and the process with Altrui was more that they were in charge of the match rather than me. So it wasn't a case of I was given 6 profiles and then I choose from that. It was more them saying, we have matched you to this recipient, and based on what we know about you and what we know about the recipient. So it was a different experience, because I had to then make the choice of, do I go ahead with this particular donor or not for some reason. And I think that was quite, I found that quite stressful, because you don't know what you just don't know, and so you have to kind of trust the process and trust Altrui, and in a way you're kind of hoping that you get this profile and you read it and you go, oh my goodness, this woman is just like the match of me. She's me in another place, and it's not like that, and I found that quite difficult. But ultimately, I think what I was reminded of, and what I could see from the profile of my recipient, was just the warmth and generosity and kindness that came through, both in what she'd written and what I was being told, but also just from the fact that she was a donor, that she was offering to do this for somebody, to do this for me, and ultimately, I just think that's a wonderful starting point. Physical characteristics, educational background, anything like that is I don't know, for me it just wasn't as important.
There's lots of things that you say there kind of resonate with me. I think I found the actual matching part you make the decision to go ahead with egg donation, and then that's not the end of it. It kind of resurfaces some of the grief, really, and I think you do kind of look for yourself, and it's kind of coming to that conclusion that you're not going to find the clone of you, and working out what's important to you. And I always think it's really lovely that you've got that letter now, that you can kind of show your child, and you can kind of understand a bit more about why they donated, and that's something I kind of wish I knew now, in hindsight. But yeah, so in terms of, you've mentioned a little bit as you were talking, were there any sort of real kind of fears for you in kind of taking this path to parenthood?
Yeah, definitely. I mean, as you said, there's this process of kind of grieving, really, of this letting go of what you thought, or how you thought things were going to be, and the route that you thought you were going to take to become a parent. And I guess what I experienced is that is very much a process. It's not that you just make the decision and then all of those doubts and fears go away. And I sort of thought that once I was pregnant, they would go away, that everything would suddenly feel like, oh, my baby's on the way, and there would be no doubt at all after that. And I was really quite surprised to find that wasn't the case, that all throughout my pregnancy, I didn't worry about it constantly, but I did have this fear of, what will happen when the baby's here? Will I bond with the baby? Will I like the baby? Will I like the look of the baby? Like, just all of these things were sort of bugging me. And it didn't matter how many people tried to reassure me, because they weren't in the same position. But what I will say is all of those fears disappeared the minute that he arrived, literally the second he arrived. And since then, it just hasn't bothered me at all. I think about it in a positive way. Like, I'm fascinated to sort of see how he develops, and the kind of the donor element to me it's actually kind of magical. I can't wait to sort of to see what traits he has, and what things are like me or not like me. And but no, all of the doubts and fears that I had before he arrived they don't matter at all. You and I have spoken about it previously. It's the most important decision you make at the time that you never think about again. I would never look at him now and go, do you know what, maybe I should have waited for the next donor that was recommended. It just never crossed my mind.
That's exactly, I love your honesty there around kind of how after getting pregnant, it is at the time, it's about getting pregnant, because you've tried for so long and you've wanted that for so long. But I think it's worth just managing expectations as well, that actually those fears don't disappear. And I always say to people, and this is kind of in hindsight, I've worked out that at the stage you're pregnant, the only thing you really know about your child is that they're donor conceived. And that's it really. And so there is still so much unknown. And that's why the kind of the donor conception part of things can feel huge. And then you have them and then you meet them. I remember when I met my girls, and then they start to become their own little personality, and you fall in love for them for who they are. And then there is so much more to them than the fact that they're donor conceived. And that's why I think it's so important that we talk about these emotional things and these fears, and we recognize that we probably are going to worry about not having that attachment and bond as the non-genetic parent. And I remember worrying that my children might have this sixth sense that I wasn't genetically related to them, which is far from the case. And we've kind of attached and bonded right from the start. And that's a process. It grows with time. So that's, yeah, I'm really pleased that you raised that, Jocelyn, because I think it is important to kind of recognise these.
It is. And to be honest, I felt really quite ashamed about those doubts, because these two donors had done something so magical and so wonderful and so kind, and I'd gone to such effort and such expense and time to create this baby, that the thought that I was fearful in some way of their arrival was really quite distressing. So
yeah, and I think it is one of those things, when you've wanted something for so long, you can, if you have any sort of doubt or worry or find something hard even during parenting, you feel guilty because you think, well, this is what I wanted, It's being kind to yourself and understanding that there are so many things still to process, and it's that making that decision to use a donor isn't just a one-time decision. It's not just a medical process. It's something that is part of your family story, but is also the start of your child's story as well. So yeah, I think it's really important to recognise those emotional challenges as well. Thank you so much for sharing with us. I'm going to move to you now, Sally, if that's okay. And I'm going to try not to get emotional, because every time I speak to a donor and they start talking about what they've done, I get really emotional. Could you just talk to us a little bit about what made you want to do something so wonderful that has probably completely changed somebody else's life?
Hi, Becky. Yeah, it's really funny. You should kind of almost introduce me like that, because actually when Jocelyn was talking, I was getting emotional from the other side of things, actually, and kind of knowing that something that I could do for someone could actually produce a child. And I'll go on to that in a minute, but I'll backtrack and kind of tell you a little bit about my kind of story. So the way I'd like to, again, you've set me up for kind of an emotional aspect, but actually what I kind of would like to start saying really is I haven't got a big sob story to kind of give you. My story is kind of quite factual, that I actually heard about egg donation through someone that was doing a exercise class with me. And they said to me, oh, I won't be here next week because I'm donating my eggs next week. And that was the first time really that I'd heard about being able to do that for someone. And I kind of, they told me all about Altrui, and I kind of explored it for myself. And in a way, it wasn't a, oh, should I don't know about this. It was a, yeah, I'm doing that. I fit all the criteria. Why wouldn't I want to do that for someone? So the process of actually inquiring, then being set up with a conversation, was a really easy process. And it was really explained to me from day one that this wasn't my baby. And I really want to kind of stress that, that from my perspective as an egg donor, I wasn't giving a child away. I wasn't related to this child in any way. And Altrui really kind of talk to you about that, and they give you support. You know, I've had counselling through Altrui to be able to understand that I might get a knock on the door if a child born out of my eggs it hits 18.
Yeah,
but I also may not. And dealing emotionally with that process, Becky, you were talking about the emotional kind of impact. it's not something that I think of all the time. I don't kind of sit there wondering about it, but it does kind of cross my mind, and I go, oh, that would be really exciting if that happened. Yeah. But also I don't kind of go, oh, I really hope it could happen. Yeah. So Jane, I think Lucia actually mentioned right when she was introducing me at the start, I've done multiple egg donations, so not just one. So it's, you know, hopefully that kind of reassures people to know that it's not a horrible process at all. It's a really lovely process. Very little pain involved. It gets a bit hectic towards the end of kind of treatment cycles with doing scans. But other than that, actually, it's a really lovely process.
Yeah, and that's good to hear, because I always I think about people who go through egg donation. It's very different to sperm donation. It is you have to invest your time. You've got, I mean, having been through IVF cycles myself, I know how time consuming it is and how unpredictable it can be. And I can imagine the thought of you're doing this for someone else is on your mind as well. And did you feel sort of any pressure at all in terms of how many eggs am I going to create for this person?
Yeah, I certainly can. You do have that in your mind, and when you get told the number of eggs once you've had collection, you kind of go, well, what's that going to mean? Because I suppose that, you know, you can have a certain amount of eggs, but it not produce into a baby at the end of it. So there's always that slight, is this gonna, you know, you have your fingers crossed for your recipient, and you kind of, it's important not as a donor not to dwell on that, and I hope that my recipients don't kind of feel any pressure as well. It's interesting what Jocelyn was saying in relation to, I want to backtrack again into that matching process. So yeah, she was talking about kind of the stresses of that kind of process in relation to matching. From a donor perspective, I fully kind of put my trust into Altrui that you guys would kind of match me in some way to my recipient. It felt nice actually from my side that I wasn't doing that kind of dating profile that she was kind of explaining, that I didn't have a list of people that I had to, who am I going to potentially make a family and who aren't I? So it was quite nice to know that that wasn't in my hands. So that process was lovely actually. And I tell you what, when I get that message to say you've been matched to someone, I can't explain to you how amazing that feels, to know that someone is kind of potentially going to go down this journey with me.
That is so amazing. You've pretty much answered all of my questions about how do you feel. So, but yeah, I just want to say just thank you, because I can't think of many other things out there that can change somebody's life in such a fundamental way. And yeah, I'd never even heard of egg donation before I needed it myself. And I'd like to think that if I'd have been in a position to, I would have wanted to do what you've done. But I know it's not a simple, easy thing to do. It's to go through physically, but also it's quite a big emotional thing you've got to consider as well. And in terms of, there's going to be a child created that shares genetics with you at some point, who may contact you to find a little bit more about you at the time, and when they turn 18. So yeah, I just thank you. It's just such an amazing thing, and the fact that you've done it multiple times as well to help people is just incredible.
Yeah, and just picking up on that point, and I mentioned it before, you know, I would welcome a child with open arms if they knocked on the door. But just to reiterate again, you know, that isn't my child. You know, I really want donors to kind of understand that as a recipient, to understand that as a donor, we don't view them as our child. And that might sound a little bit harsh, but it's important to remember that as a recipient, it's your child. You know, you know, we've helped you hopefully on the journey to be able to get there. But you know, whether that child has us in our lives in some way, then great. If not, then you know, we'll know that we'll always be thinking of them in some kind of degree.
Yeah. And I think just picking up on that before I hand back over to Lizia, I think the whole, if I reflect back on my own feelings towards the donor, like they have shifted so much over the past sort of 5 years. And I remember at the time I felt very vulnerable going through the process and almost a little bit unsure. I felt a little bit threatened by the thought of someone else sharing genetics with my child. And it's only as I've kind of become a mum and I've talked to my girls all about it, they understand how they came to be. But I have felt so much more relaxed and comfortable about that thought. I've actually become more curious myself, and I'd love to be able to thank her one day. And I think it's when you become more comfortable and you've built that bond with your children, you can kind of process more in your mind the fact that if they decide to contact that donor later on in life, it's not because they're wanting to replace you as a parent. You are their parent and they love you. And if they want to look for the donor, it's because they're curious, and it's natural that they might be curious about where half of the genetics came from and want to know a little bit more. So yeah, I think I just wanted to mention that because that is something that does shift over time. And I think many parents who I've spoken to have said the same. And I think it would be lovely one day if that happened and that recipient could thank you as well. So yeah, I'm going to hand back over to you, Lucia, now, because I think we've had quite a few questions through.
Thank you, Becky, and thank you, Jocelyn and Sally, for sharing your experiences. It's great to get together and hear these experiences. I think we should move on to the Q&A because we did receive many questions. If we don't have time to answer them all, we can answer them by email. So when we send you the webinar recording, we will include the questions and the answers. And we're always available to answer questions by phone or via email. I will pop the details into the chat so you know our phone number and our email address. So the first question is probably for Lisa and Jane. What are realistic success rates with egg donation? And is it normal to be successful with the first round of donor eggs?
Sorry.
Jane, do you want to start?
Yeah,
I've been answering some of the questions on the chat, so I hope people can see those. Okay, Jane, you go first.
If obviously we can share a response to this one, but I think certainly the success rates with egg donation are very good. We're using healthy donors that we are taking through. Some of those donors have proven fertility. They will have had an assessment to look at their ovarian reserves. So we really want to try and supply recipients with really good quality donors. And as a result, I think the success rates are in the region of about 70%. It depends obviously which clinic you go to. It depends on other parameters as well. There can be sperm factors there, which can influence success rates as well. But I think generally speaking, they are sort of around the 70% mark. We're sort of running at the upper 70s with the majority of clinics, and that is with fresh cycles and with frozen cycles as well. And that is collectively over that sort of 10-year period that Altrui has been running. So, you know, and I think we consistently have been the highest success rates. Yeah, I don't know if there's anything that you wanted to add to that at all, Lisa.
Just really that Jane's correctly identified everything, I think. The only thing is extra is that we only accept donors up until the age of 36 because many studies have shown that after the age of 36, a woman's egg quality and fertility declines. So that's why we have that cutoff. It's not to say that many women fall pregnant naturally after the age of 36 and have very healthy babies. But when we're running a process of egg donation, we need to have certain criteria. And so that is one of the criteria, and that's based on sound clinical evidence. So up to the age of 36. So the donor needs to be 35 years, donate before her 36th birthday.
Okay, thank you. The next question is, it's also about success rates, but more related to age. Do I have chances of getting pregnant at 45 years old? My period stopped 5 years ago. And then also related to age, do you cap egg donations recipients' age?
So to answer the first question, it's if the lady's period stopped 5 years ago, it is unlikely, but one would need to do a number of investigations to see what the cause of the periods stopping were, because there are many causes of periods stopping, not just early menopause. So she would really need to see a fertility specialist or a gynecologist to investigate the cause of that. And then the second part of the question is there an upper limit on when a woman can go through an egg donation cycle? In the UK, most clinics will accept, will be prepared to do an embryo transfer. That means take a donor egg, which has been fertilized, and transfer it into the woman up until the age of 50 or 51. And some clinics 52. In other parts of the world, Eastern Europe, Russia and South Americas, they do have, and India, they do have higher age limits. But in the UK, the average cutoff is 50 years old. Yeah, and that's because of, it's not because we want to discriminate against women, it's because pregnancy in older women is a far riskier process. These women are more prone to cardiac disease, preeclampsia, and so that's the reason, really, to for the woman's own health. Yeah.
Okay, perfect, thank you. I see lots of questions coming in about the ethnicity of donors. So, for example, yeah. I'm of Indian origin. I'm looking for an Asian donor where color matching is very important to me. Do you have any Indian egg donors? But also, I'm a Black woman. Are there a wide range of egg donors of different ethnicities? And then again, I'm a white male and my partner is Black, British, Caribbean. I have read that there are not so many egg donors who are Afro-Caribbean in the UK. Is this true? And could this pose a stumbling block for us?
Yeah, maybe I could step in there. I mean, I think ethnic minorities, yeah, it is difficult to try to recruit donors that are Indian or Caribbean in origin. We do get them, we do. And obviously we onboard them and we take them through the normal assessment process. It is, I suppose it's difficult to give a predicted time frame for anybody coming through Altrui, because we like to try and be as realistic as we possibly can when we work with our clients right from the outset. We do look at what alternative options would be acceptable. So, for example, we do have some Indian ladies on the waiting list who would be happy to consider a Caucasian donor, maybe with darker features. So it's about what is acceptable to you, and we work with you on that. So if there are alternative options, yep, absolutely, we're very happy to look at those and look at what the options are. If we're looking for specific ethnicities, sometimes it's better that we put you almost onto a reserve list, because we can't guarantee that we will find that donor for you within a specific time frame. But we're very happy, obviously, to work with you in trying to source that individual. And I think the other thing to say as well for Altrui is we always like to keep it very fluid. So we like our donors to come in, to be onboarded and to be matched very quickly. We're trying to source specific egg donors for our recipient couples. So for us, it's not like an egg bank. It's not where we're looking at freezing eggs or you know, keeping our donors waiting. For us, it's really about appreciating and valuing our donors, making sure that we make those specific matches as quickly as we possibly can, but the match has to be right. And we keep it very fluid. So we never have a large reserve of donors. We really go out there to try and source a donor for an individual couple.
And Jane, since you have just mentioned egg banks and frozen eggs, there's someone asking, is there a difference in success rates between using fresh versus frozen donated eggs?
Yeah, I mean, definitely we truly believe at Altrui that fresh eggs are a preferred option. And I think from an embryology perspective, I think the preference would be to use or to be working with fresh eggs. Statistically, I know that the advances with egg freezing and thawing have improved dramatically over the last number of years. But certainly for us at Altrui, we do believe that fresh eggs is going to give you the best chance of creating not only an embryo, hopefully for a transfer, but also some embryos that you can store for future use if you choose to do so. Lisa, I don't know whether you wanted to add anything from a sort of medical perspective there with regards to success rates and preference.
Yes, there's lots of evidence to support the fact that fresh eggs there are higher success rates associated with that. It's not the same with embryos because of the and the reason for that is that the egg has got it's got a big cytoplasm, which is a kind of a vacuole with lots of water in it, and with vitrification techniques, that's the new fast freezing, and the embryologists they collapse eggs, but they are always, the more water a cell has, the more ice crystals that can form during the freezing, and it's these ice crystals that are damaging to the cell. And so whereas an embryo has less of these, has less water and so less ice crystals, and certainly modern success rates with regards to fresh and frozen embryos are very similar, but we do see a big difference still between using fresh and frozen eggs. So that's why we would encourage the use of fresh eggs. And when it comes to embryos, fresh or frozen, there's not really much difference.
Perfect, thank you. And then we received a question, or Becky received a question earlier this week. Is there a need of doing PGS, so pre-implantation genetic screening with egg donation?
Okay, so is it Becky? Yeah.
Becky received a question from one of her followers.
Oh, okay, all right. So this is a very, very hot topic now at the moment as well in IVF, and there are lots of debates among experts in the field. So for those of, I presume most people I'm sure know what PGS is. It used to be called PGS, which stands for pre-genetic screening. Now it's called PGTA, which stands for pre-genetic testing for aneuploidies. What it means is that we test the embryo on day 5 for abnormalities. And how this is done is the embryo is cultured in the lab until day 5, and then the embryo has a ball of cells, which becomes the baby, and an outer layer of cells, which become the placenta. And the embryologists biopsy, which means take 2 or 3 of these outer layers of cells and send them off to the lab for testing. And this is done through a way called next generation sequencing, where they make many, many copies of the DNA. And when PGS first came out, we were given 2 results, which was normal or abnormal. Okay, and nowadays, because the techniques are much better, we have three diagnoses, which is normal, abnormal, or mosaic. Okay, and mosaic means that there will be some cells that are normal and some cells that are not normal. And so what the advice generally is that say you have 10 embryos and 4 of these are normal and 2 are mosaic and 4 are abnormal, one would transfer the normal embryos first, and then if the woman is not pregnant, then consider transferring the mosaic embryos, whereas previously we were discarding everything that was abnormal. And the reason for this is that embryos have some, because the biopsy is taken from the placenta, there are some cells that might be abnormal, but it doesn't mean that the whole embryo is abnormal. And embryos are very clever, and they have the ability to what's called autocorrect. And so there might be some of these bad cells which are naturally discarded through a kind of natural selection process. And so the question there that's raised is, are we potentially discarding an embryo that comes up as our result as being abnormal, and actually that could result in a normal baby? So that's the one camp of thinking where they say, and certainly the HFEA, who's the regulatory body in the UK, has put a red light on PGS, saying that it should not be done. However, there are specific circumstances, individual to couples, where PGS does help. One example is women with recurrent miscarriages. So because the evidence suggests that whilst PGS in itself doesn't produce more live birth rates, it can increase the woman's time to getting pregnant with a normal embryo, because we know from PGS that we are transferring a normal embryo, and so that's more likely to result in a successful pregnancy. So really going back to to the question, should one do PGS or not on donor eggs? PGS is something very specific to each couple's individual circumstances. In cases where there are more embryos, it's more worthwhile to do PGS. If a couple only has 2 or 3 embryos, then usually we wouldn't suggest it, because the process of doing the biopsy, freezing the embryo, thawing it, all of that could compromise the embryo. So there are all these specific situations. So usually for older women or women who've had recurrent miscarriages, or where we've got a good number of embryos, so say more than 8 or whatever, 5 or 8, then there is definitely a role for PGTA, for PGS. However, it's something that really needs to be individualized and discussed with the couple, and see if it's right for them. So unfortunately, not a blanket answer. Yes, there is a role for it, but it needs to be done in the right circumstances.
Thank you very much, Lisa. I think we have time for one more question. And this is not really a question, actually. It's a comment, and maybe, Becky, you can comment on it from your experience. Someone saying, I worry about protecting my child from other people's negative reaction to them by not being blood family.
Yeah, I hear this a lot. It can be I think one of the biggest fears that people have is, what will others think, and particularly what will the rest of the family think. And I personally, from my own perspective, have had no issues whatsoever in my family accepting our girls, and they love them. They couldn't love them anymore, even if they were genetically related. But I know donor conception is still, it's not talked about. There's little awareness of it. There still seems to be quite a lot of shame and stigma attached to it as well. And so that's kind of one of the things I try to do, is to try and raise awareness. And I have found people have introduced the concept to their friends and family just by sharing my Instagram account or my blog, and allowing them to see the reality of what life is. We are just a normal family. We were just made in a different way. There is nothing different about us. Our day-to-day is exactly the same. But there are some more difficult conversations you've got to have, and things you've got to think about. And this is a big topic that I cover within Paths to Parent Hub. So if you did want to join as a member, there are some past resources where I've had conversations with experienced counsellors about talking to friends and family, things to consider, how you might word things. And I'm actually working on a resource which I'm hoping to launch next month, which is specifically designed for you to give to your friends and to your family to say, this is what egg donation is, or this is what donor conception is. Here are some personal stories for you to look at and understand from. Here are some experts talking about what it is, why it might be needed, and also experts talking about how they can best support you, because actually they play a really big role. Because if you're going to be open and talking to your child about this as something that you've come to and you want to share with pride, and that you've worked so hard to get there, you want your family to also be aware, and to, if your child is to then speak about it and talk about, my girls talk about mummy's eggs were broken, and so we needed some help from a lady who gave us some eggs, and that was put with daddy's seed. And you just want them to be in an environment where they can start talking about that, and they're not met with shock, horror, and what are you talking about? So I think it is a difficult one. I don't think you should feel like you've got to tell everybody. You're allowed your privacy, but there are certain people in your life, within your support circle, that it will be important for them to know. And so I hope I've kind of answered that. I understand it can be a really, really difficult one, and something that people do worry about. But the majority of, I very, very rarely, and I speak to many, many people, very rarely hear of any negative reactions. And like I say, once that child is there, they start to see them for themselves. And at the very beginning, during pregnancy, it can, like you say, like I said earlier, the only thing you really know about them is the fact that they're donor conceived and they're a baby. And yet now, my girls, there's so much more to them than that. And my whole family adore them just because they're them. And there's no doubt in their minds that they are their grandchildren and their nieces. So yeah, that's my answer to that one.
Thank you, Becky.
They've even, if I could add to that, they've even been studies done where children are adopted, and people who don't know, either usually friends, because family members would work it out, but people who don't know that the children are adopted still assimilate them with their parents and say, oh, she's got eyes like her mummy, or she's got, her father's chin, and there's no genetic material. So I think generally people are really surprising in how they want to assimilate new members into their family and into their groups, not exclude them. So I think generally, and we live in such a multicultural society. I think there's a lot less of that nowadays, and generally, when certainly I see in my circles, when the fact that a woman's had to go through so much to do this, I think that would be the last thing on most people's minds. So they really, people are generally supportive.
Yeah. Just to add as well, you just made me remember, I actually wrote a blog post last year, which is just entitled Dear Loved One, and it was just a way that you can kind of talk about all of the different emotions you've gone through, because the last thing you want is to go through this journey and make that decision and then someone to question that decision. And so maybe we can put a link to that at the on the notes at the end. That might help. And it's a difficult conversation to bring up, but I think if you've got some resources and some other stories and things to share, that it should help, hopefully, to educate in a way about the fact that families come in different shapes and sizes and are made in many, many different ways nowadays.
Yeah, it's called Creating Modern Families.
Thank you so much. Everyone. Unfortunately, it's time to wrap up. But I would like to thank this incredible panel for sharing their stories and knowledge.